Jo Pitzel. I spent 10 years covering politics and policy at the state capitol and currently write about child welfare. I'm here to talk about what's happening fiscally in the nation. We have tax rates going down, but the national debt is going up. And there's expected to be an increase in health insurance premiums as well. That's because Congress late last year passed a tax cut package. It reduces rates, which advocates hope will bring corporations back from overseas and incentivize employers to add jobs and raise pay. Skeptics caution there's not a real good track record to show that that will happen, and fear that the biggest benefit will go to corporate executives and shareholders. The implications for the national debt are expected to be as much as $1 trillion added to a debt that is already $20 trillion and rising. And on the healthcare front, that tax cut package eliminated the individual mandate that all Americans carry health insurance. That's expected to raise insurance premiums as more people drop out of health coverage.
Okay, so let's go to our first question in this segment. Show of hands. How many of you see the $20 trillion national debt as a significant issue for this Congress now? Okay, unanimous. I think the next question is for Representative Lovis, if not mistaken. Or is it Senator Lesko? Sorry.
I don't know.
This is a segment question, so I think it's to you, Representative. The Trump tax cuts are expected to add another $1 trillion to the national debt at this point. How would you prefer to bring down the national debt, given the numbers that we're seeing? As you know, about 75% of the budget is wrapped up in things like Social Security, Medicare, Medicaid, national defense, interest on the debt. So with that in mind, should we change eligibility for Social Security or Medicare? Should we cut spending on Medicaid or national defense? Do we just add to the debt or cut the rest of the budget?
Well, that's why I'm going to turn down a pension if I'm elected to Congress. We don't need Congress people adding more debt to the federal budget. You know, certainly that's one of the things that's important to me. I did that at the state legislature. I turned down a pension. I sponsored the bill which shut down the elected officials' pension plan. And in Congress, I will turn down a pension as well.
But is that enough to bring down the national debt?
It's a start. We all have to do our part. Okay, let me give you an example here. Senator Lesko loves to talk about what she's done for, you know, the corrections officers' pension plan, police, and firefighters. But the fact is, she is willing to slash anybody's pension but one person, her own. She took a state pension. She'll take a federal pension. So if we're going to talk about debt and the problem of debt, it has to start with us and what we're willing to do. And that's why I have said I will not take a congressional pension.
Senator Lesko.
Is this in response or
no? This is your answer, unless you want to respond.
Okay. Well, I want to respond first, if you don't mind. You know, the thing is that I have sponsored pension reform that saved $500 million for the taxpayers and sustained the plan. Unfortunately, I agreed with the concept of getting the elected officials 401k. I voted for Representative Lovis's bill at the time. However, he didn't do it correctly, because now it's going to cost, I think it's $27 million a year. It's just not funded correctly, and it wasn't done right. But in answer to your question, yes, we have to reduce the debt. $21 trillion is totally unacceptable. We need to reform the entitlement programs. We need to protect the seniors, though, and the people that are going to become seniors. But we can start changing it moving forward. It just has to be done.
Changing eligibility for it, raising retirement ages, or qualifying for Medicare?
I think there's a variety of things that we can do, and I'd like to talk to other experts on that. But just like pension reform, I did it, and moving forward, we changed it so that it was sustainable. I think we need to do the same with entitlement reforms. I also think we can cut money and save money in bloated agencies. I think that's a good place to start. And I love the tax reform bill. I love the tax cuts. I think it grows the economy. I'd actually like to go further and make it more simple, so that we could all fill out our taxes on a postcard would be great.
Right. Mr. Van Steenwyk.
I believe we're starting off on a false premise here. The national debt is over $130 trillion when you add in all the unfunded mandates. with all the retirement packages and benefits and Social Security. It's not 21 trillion. So that in itself is not correct. Yeah, we need to cut it, but one really great way to cut it would be constitutionally, we're allowed 4 departments in this country. 4, not what we have. So why don't we start closing down the departments, you know, like the government shutdown, where they closed all unnecessary government agencies,
Can you be specific?
which is
Which
most of
ones?
them. Pardon me?
Can you be specific? Which ones?
Oh, let's see. How about the Department of Education? How about the Small Business Administration? How about the EPA? All of these duties belong to the states. They do not belong in Washington. We've had congressmen, senators, and local legislators all across this country that have allowed all the power to shift east. That's not where it belongs. They make beggars and welfare workers out of state agencies, and they sit there on the, I guess you'd call it the mother's milk of government or politics, begging for money to come back. The only way sincerely to stop this is to begin to trim the entire government of all the unnecessary and unconstitutional departments and agencies it has. And also, you want to fix Social Security? How about the federal government paying back all the bonds that Social Security has bought on their debt?
Okay.
Because they're the biggest holder of America's debt, not China.
Thank you. Commissioner Stump.
Ron, thanks. And I'm a deficit hawk, but we're talking about $1 trillion out of the projected $43 trillion that the government is going to take in over a decade. And if Senator Pat Toomey is to be believed, and I do think he should be believed, as I said earlier, if we get GDP growth of just 2.2% to 0.4%, with the extra revenue that comes in, that will wipe out the $1 trillion deficit. With regard to the Obamacare mandate, that should save $300 billion over 10 years, partially due to the fact that users will not be taking Obamacare subsidies. With regard to your question about Social Security, I think we need to have no changes of ineligibility in terms of those taking benefits now, those who will be taking benefits in 10 years. I think we need to look at the 55 or under age bracket in terms of reforms in that area.
Okay. Senator Montenegro.
Yeah, the debt, and I share a lot of sentiments here. It's just impossible to go through them in 1 minute. Look, the debt is unexplainable. It's just, it's morally wrong to where we've allowed this country to go into debt. So we do need to cut spending. That's the number one thing we need to do. We need to make sure that we understand the Constitution gives certain parameters under which government should operate. First of it should be making sure that we're eliminating a lot of programs that shouldn't be there. And that's just not the role of government. Many have been mentioned again. There's different agencies that we can go into, but the reality is that we need to make sure we're cutting government spending. The second thing is balanced budget amendment. I actually supported that. I voted for it. I helped to get ushered it through the legislature. We need to make sure, just like every family out there has to have a budget and lives on a budget, government needs to live within its means. And at the same time, we also need to make sure we're growing the economy. And that's something that President Trump's doing a great job of right now, and I want to get in there and support him as well.
Very good. Representative Lovis.
Yeah, we've got a $20 trillion debt, and we've got about a $600 billion deficit every year. So I think we can grow our way out of this. Nobody ever thought that we could get to 3% GDP growth. Hopefully we're on our way to 4% this year. So I think we're in great shape with President Trump there. I mean, we've got record stock market levels, jobless claims the lowest in 45 years. The economy is booming, and it's a big reason why, because President Trump is there.
Okay. Next question. This one goes, we'll start with Mr. Van Steenwyk. Last year, President Trump and congressional Republicans sought health care changes that would have saved the nation about $119 billion over a decade, but would have cost about 23 million Americans their coverage. Repealing the individual mandate is expected to save about $43 billion in government expenses in the future, but raise premiums for everyone. What else, if anything, should we be doing on health care?
How about competition? When you eliminate the lines between states, no borders for insurance. I happen to know about this because I sold insurance a long time ago. I don't know if any of you are old enough to remember when you couldn't buy car insurance across state lines. Premiums were out of this world in California. Then all of a sudden someone got a genius idea to allow it to happen. My insurance went from $900 a month down to $350, or a year, down to $350. It's still fairly cheap compared to what it used to be. That's all we need to do. There are simple fixes. But one other thing we need to understand here is government doesn't make our economy work. They're actually the enemy of it working properly. All the regulations and everything else they put in place. I started a business years ago that cost me $1,000 to start. Today I need $150,000 just to fill out the paperwork. So I couldn't have started the business and hired people. Government is the problem in every private industry we have. If we can get them out of the way, we can actually grow this economy at 6 or 7%. But growing the economy isn't going to shrink the debt unless we shrink the government.
Okay, very good. Commissioner Stone.
Well, Ron, life expectancy in the United States is down for the second year in a row, and that hasn't happened since the early 1960s. I think that's troubling. And the irony is that as this has been occurring, federal spending on healthcare has grown massively. From 2013 to 2016, healthcare spending actually grew faster than the economy. President Trump in October of last year issued an executive order, which I think was on the right track, trying to expand the use of short-term plans for people to take advantage of, trying to expand the use of association plans, which I think is an excellent idea, in which small businesses come together, pool their resources, and buy health insurance. We haven't chatted about the opioid crisis yet, but that really does relate quite intimately to Medicaid patients who are much more susceptible to being prescribed opioids. And perhaps as the segment goes on, we can get into that in greater depth.
Senator Montenegro.
So look, this is something that, first of all, with the individual mandate, it had to go. It's morally wrong to force. Nowhere in the Constitution is it even allowed for the government to come in and force an American to buy something. So it had to go. It was wrong. What we need to do is open it to the free market. There's so many things we can do. Some of them have been mentioned. We have to make sure that we're opening across state lines. We have to make sure that we're allowing individual choice, individuals to choose what type of plans they want, maybe have health savings accounts. We have to make sure that we allow the free market to take its course, and at the same time allow patients to choose what type of coverage they want.
Representative Lovis.
Well, healthcare seems to be the only industry that as technology advances, prices go up. And that's because we have a highly regulated state market. Obamacare has driven prices up and it's driven choices down. But there's a few things that we can do. Certainly one is selling across state lines, that's been mentioned. Tort reform, that's going to be huge. Doctors run a lot of tests to cover themselves due to the threat of being sued. Reducing regulations on insurance providers and reducing taxes on insurance providers as well.
Senator Lesko.
I would vote to fully repeal Obamacare. I think it's an atrocious bill and it should go away. What I do think we could do is health savings accounts, allowing people to buy insurance across state lines, but also price transparency I think will drive down costs, meaning providers should list what their prices are so that people could shop for the best price.
Okay. Okay. Next wild card question. This one is for you, Senator Lesko. You've introduced bills that would have helped APS and pushed at least 2 bills that would have significantly raised utility costs for solar customers. That would have especially impacted people like West Valley retirees who frequently have solar on their homes. You also would have hurt one of the fastest growing industries in the country and here in Arizona. We were number 3 in the nation in terms of solar in employment growth. You've also pushed ALEC-sponsored legislation that has caught the eye of some of our readers, and the expansion of a private school-style voucher system that uses funds that would have otherwise gone to public schools. The question is, what do you say to people who worry that you put industry interests ahead of consumer interests?
That's totally inaccurate. The bill that I did helped consumers. So I represent Sun City. A Sun City couple came to me and were basically ripped off by a rooftop solar leasing company. So my bill put in protections for the consumer. And more I saw these greedy companies that were being deceptive, trying to rip off seniors in my district. And so that was an ALEC model legislation. After I passed it here, other states are using my consumer protection because we want to support all types of energy, but we don't want people being ripped off. As far as my ESA school choice bill, I really believe that parents should be able to choose the best education for their child, no matter where that takes place. My children went to a district school, but I also believe parents should be able to choose between public district schools, public charter schools, private schools, online schools, and homeschooling. It's all up to the parents and the students. Other states, they don't even have open enrollment. It's terrible. And so parents are stuck in the school district that they were in based on what they can afford. I really believe parents should choose. There's huge waiting lines to get into charter schools. Parents love choice.
Okay, so let's take one more brief break before we go to our last segment and closing statements.